This video segment is prepared for the beginners, in fact, to tell you that what is the definition of a normal renal parenchyma. This is the right kidney, and here you are seeing the upper pole, mid region, lower pole. This is the capsule, and below the capsule, the area you are seeing is the cortex. Now these tiny cystic areas are the pyramids, renal pyramids. So in this patient, the corticomedullary differentiation is intact. Now what about the thickness of the parenchyma? Parenchymal thickness is normal. We include both the cortex and the medulla, and we can see that the thickness is preserved. Now what about the echogenicity of the parenchyma? Parenchyma means including the cortex as well as the medullary pyramids. Now you see that the echogenicity of the kidney is appearing less as compared to the adjacent normal liver. So this is a normal liver, and the echogenicity of the renal cortex is appearing less. And the definition for a normal renal parenchyma is that provided the liver parenchyma is normal, then its echogenicity will be equal to or less than the adjacent parenchyma, which is the case in this normal patient with normal liver and normal kidneys. Here I have magnified a bit so as it will become easy to you for the evaluation. एक लंबा सा किस्सा रोको. Patient is in left lateral decubitus posture. I have asked him to take a deep breath and hold the breath solidly. Now you see this is tiny cystic area, tiny tubular area. This is the arcuate vessel. Should not be confused with a calculus or concretion. Now with patient in supine posture, again if we see, you can make out that the echogenicity of the normal parenchyma of the kidney is less as compared to the normal liver parenchyma anterior to it. And even in transverse section, you will see the same, that the echogenicity of the cortex, the parenchyma of the kidney is less as compared to that of the overlying liver. So, and you can see this small cystic area is the pyramid, and this is the cortex. So intact corticomedullary differentiation with normal parenchymal echogenicity. Thank you very much. This is a video segment for the study of the comparison of the renal parenchyma with that of the adjacent liver. Now, in this patient, what you are seeing is that the kidney parenchyma is appearing so black, total parenchyma is appearing so black, and this is the central sinus echocomplex. The thickness of the parenchyma at upper, mid and lower region is preserved, and it appears as if the echogenicity of the parenchyma has significantly gone down when we compare it with the liver anterior to this kidney. Now why this kidney? Is this kidney a diseased kidney? Now you see that the liver is fatty, is showing fatty liver changes. Here you can see there is muffling of the periportal echoes, and in transverse section as well. You can see that the adjacent liver appears too bright compared to that of the right kidney. Now, is the kidney diseased? In such cases, ask the patient to turn to left lateral decubitus posture pathological and try to study the kidney in separately without any organ anterior to it. Now I am scanning the same kidney but with patient in left lateral decubitus posture, and you can very well see that there are pyramids seen there. This is the cortex, central sinus echocomplex, thickness is normal, upper fold, mid-region, lower fold. Now preserve this segment of the kidney on one side of your screen and compare it with the liver now. And you can see that the parenchymal echogenicity of that of the kidney is less compared to that of the adjacent liver, though the liver is fatty. There is diffuse increased parenchymal echogenicity of the liver. You see periportal echoes are attenuated, and the parenchyma of the kidney is seen normal. Now you see, whenever we can also go to the prone position to evaluate the kidney. Now this kidney is normal. There is nothing wrong with this kidney except that there is no calculus. The parenchymal echogenicity is absolutely normal. Now when we see it with a fatty liver anterior to it in longitudinal section, we can't make up the details. And if I raise the gain, even then it's difficult. I have raised the gain significantly, but even then it's not possible to make the detail of the kidney. And in normal gain settings, except that the parenchyma is appearing flagged, nothing else is seen. So this is a normal kidney, but is appearing black because the liver is fatty anterior to it, and we know that the sound waves are absorbed with higher frequency by the fat. So by the time the sound waves reach this area, they are attenuated to the extent that when they return back to the transducer, they are so attenuated that they give this area a black appearance. And second thing to see in fatty liver, depending upon the degree of fattiness of the liver, you will see that the diaphragm, this is the right hemidiaphragm, will appear thin. It's appearing thin, papery thin rather. So this is the second point of understanding that why the diaphragm is appearing papery thin. And again you see, this is the hepatic vein. They don't have any echoes around. This is the portal vein. Again, attenuation of the periportal echoes is obviously seen. So this is to be remembered regarding a renal parenchymal study. Thank you. Now let us study how to compare the renal parenchyma, echogenicity of the renal parenchyma. Is it normal? Is it reduced? Is it increased? Now in this patient you can see that what's the normal? First, I should tell you that normal is that provided, number one, the most important thing is provided the liver is normal, then in that case the echogenicity of the liver parenchyma. Now this is the cortex below the capsule, this is the cortex of the kidney, and you can see these are the pyramids, and if we combine both these, this becomes the parenchyma of the kidney. Now in this case, what we are seeing is that echogenicity of the cortex or the parenchyma is increased as compared to the echogenicity of the adjacent liver parenchyma. You see, the echogenicity of the liver parenchyma is normal, and that of the cortex or the parenchyma of the kidney is raised. Now this is opposite to that of the normal, in a sense that the normal is that the echogenicity of the cortex or the parenchyma of the kidney is either equal to that of the liver parenchyma or less than the liver parenchyma. In this case, you are seeing that the parenchymal echogenicity is raised, so this is a case of renal parenchymal disease. Now, see in transfer section even, you will find that the echogenicity of the cortex is much raised as compared to that of the adjacent parenchyma. Now let's see the left kidney, the other kidney. Now compare it with the liver or with the splenic parenchyma, but I will prefer to take a view of the kidney on one side of the screen and then take the view of the liver on the other side, so as to compare the parenchymal echogenicity of the. Now this is a normal liver with normal parenchymal echogenicity. See that the parenchymal echogenicity of the liver is equal to that of the left kidney's renal parenchyma, this area. So this is with a normal, that is that either the parenchymal echogenicity of the kidney should be equal to that of the kidney which you are seeing in this case, or the renal parenchymal echogenicity should be less as compared to that of the that of the liver. So this kidney is normal as per the parenchymal echogenicity, whereas the parenchymal echogenicity of the kidney on the right side is raised much above the normal. Now take this kidney on this side, on the right side, freeze, go to the liver, and you can very well make out that the echogenicity of the renal parenchyma is raised compared to that of the normal liver. So this is one point to remember out of many. Thank you very much. On the left side of the screen, you are seeing a liver. This is a normal liver, in fact, and this is the kidney in longitudinal section, the right kidney, and both the liver and the kidney are normal. Now, in this segment, I want to stress on the renal parenchymal echogenicity and the corticomedullary differentiation. If you see, this is the upper pole, this is the mid region, and if we see that this is the cortex below this is the capsule, this is the cortex, and here these tiny cystic areas are consistent with medullary pyramids. So the corticomedullary differentiation is intact, and the parenchymal thickness measures 15.6 is within normal. Here we will say that the corticomedullary differentiation is intact. Regarding the echogenicity of the renal parenchyma, I have narrated in the previous segment that the normal is that the echogenicity of this renal parenchyma should be either equal to or less than the adjacent liver parenchyma, and you can see that here the liver parenchymal echogenicity is less as compared to that of the adjacent normal liver. So this is a normal case study with normal parenchymal echogenicity of the right kidney. This the case up to this echogenicity of the kidney is taken normal if it is less than the adjacent liver parenchyma or it is equal to that of the adjacent liver parenchyma. Now let's see this case. In this case, again we will study the same features that this is the longitudinal section of the patient's kidney, and in which you can see that the number one, this is the capsule, this is the cortex. Okay, now see that there are no cystic areas compatible or consistent with the medulla, no medullary pyramids are seen. So in this case, the corticomedullary differentiation is lost and or muffled. And now in this kidney, the echogenicity, if you compare it with that of the normal liver, is more as compared to that of the normal. So this is the normal kidney. You can compare it with it. It's very easy now to compare these two. So this is a kidney with diffuse, increased or raised parenchymal echogenicity with muffled corticomedullary differentiation, as well as one another thing to note is extra that I am going to inform you is that this is the central sinus echo-complex fat. You can see, so don't see this in this kidney. So this is a almost renal parenchymal disease, grade 1. Now it's very common to see some cystic areas. Now do not consider the cystic areas at times seen in such kidneys. You are seeing the cystic area. This is not a pyramid. This is a cortical cyst. So this is how it goes so far as the kidney renal study is concerned by ultrasound parameters. Let's see the second kidney of the patient, pasa medulla. Pasa medulla. Okay. Now this is the second kidney. What do you say now? You can yourself make out by the description I have given you, provided you in the soluble. Lamba soluble. Soluble. Rofo. I'm trying to get the longitudinal section. So now you see that this is the parenchyma. No corticomedullary differentiation. Why? No pyramids or cystic areas are seen in the pyramid. The region of the pyramid, muffled central sinus echo-complex, echogenicity of the parenchyma is raised diffusely throughout as compared to the normal kidney. See? And if you compare it with the spleen, then the echogenicity of the kidney has gone much above than that of the spleen adjacent to it, and as well as the normal liver. So this is how we differentiate the echogenicity of the kidney: normal, raised, decreased, or the corticomedullary differentiation. Thank you very much. This is a study regarding the corticomedullary differentiation or the echogenicity of the kidney. Now, I said in the initial segment that take our longitudinal view and then on one side of the screen, now you see that this is the cortex, this there. These cystic areas are the pyramids, renal pyramids. Now this means that the corticomedullary differentiation is intact because we can see that, though the echogenicity of the cortex is raised throughout. On the other side of the screen, we will take the liver, if normal, and then compare with it the parenchyma only. So now this is the liver of the same patient, and you can see that the echogenicity of the liver, compare the echogenicity of the liver with that of the kidney parenchyma. See, this is the renal parenchyma. I am going to take a part of it just to make it clear to you. This is the hepatic parenchyma. Now, if we take these two regions, the liver parenchyma, note the brightness of this region and note the brightness of the renal parenchyma. The parenchyma of the renal cortex and is raised as compared to that of the liver. Liver parenchymal echogenicity. Now this is the normal. What is normal? Normal is that the echogenicity of the renal cortex should be either equal to or less than that of the renal parenchyma. Here you are seeing opposite, that the echogenicity of the renal parenchyma has raised as compared to that of the normal liver. Okay, the liver should be normal. This is to be kept in mind. Thank you very much. This is ultrasound study of a 50-year-old male with a history of anuria for the last 3 days. The purpose for referring. Now, this is the kidney, measures approximately 8.9 centimeter in length and 4.1 centimeter in anterior-posterior diameter. There are calculi seen, one at the upper pole, this is also at the upper pole, and this one is running from the mid-region calycis to the lower pole calycis. And you know, this is the upper pole of the kidney, this is the mid-region of the right kidney, and this is the lower pole, that of the right kidney. Now you see the parenchyma. The parenchyma shows diffuse decreased parenchymal echogenicity in this region, and the parenchymal thickness is reduced. This is the parenchyma in this region, and the parenchymal echogenicity is diffusely decreased in this region at the upper pole, with calculi at the upper, mid, and mid to lower. Now, the largest calculus, this one, measures 22.5 millimeters. If we measure the thickness of the parenchyma at this region, it's 5.4. At the upper pole, the thickness is 9.2. So the thickness is significantly reduced. Secondly, you see that there is no pyramid seen. There is absence of cortical medullary differentiation. Now this is a magnified view. You are unable to see the cortical medullary differentiation is muffled. This is the transfer section of the kidney with a large calculus seen infected in the non-dilated renal pelvis sac. This is the renal pelvis, and this calculus, this measures again 21.6 millimeters. There is diffuse decreased parenchymal echogenicity, however the hilar region is unremarkable. This is the IVC. This is the inferior vena cava, the gallbladder, portal vein, CBD, the liver, and you see this tiny cystic area is right renal artery in transfer section. So this is the story in this region, that is the right kidney, and it is not uncommon to see such findings in cases of staghorn calculus. The proximal ureter is not seen dilated. There is no evidence of hyponephrosis, and you can see this is the right kidney pathology. Let's go to the left kidney and see what is the status of the left kidney. Now this is the left kidney. You can see it's it is showing this is the left kidney. It measures in length 10.6 and measures 5.0 centimeter in anterior posterior diameter, is at the upper limits of normal in transverse section. Now what you see in this kidney is that now here the pyramids are seen. These are the pyramids. This is the cortex, and this is if we include the medullary pyramids in the cortex, it becomes the parenchyma. Now the parenchymal thickness is preserved, though is diffusely raised, and there is minimal hydronephrosis in this kidney. You see there is dilation of all the calyces from upper to mid to lower pole. This is the transverse section, and the hilar region is patent. There is a tiny convolution seen. This is the calculus, tiny calculus seen in the mid region. Now, if okay, so this is our the urinary bladder and prostate is normal. There is no finding in that region. This is the transverse section and of the left kidney, patent hilar region vessels. Here we are here. Okay, now this is our case of the day. Thank you very much.